One, two,
Hello,
three.
everyone. Good Monday morning. I'm Marie Bonaminio and happy to have all of you here today to listen to Heather Brown, who's going to be telling us about the, truth about our teeth. Let's put it that way. The title of the class is Tooth Truths. Your health starts in your head. I first just want to give you a brief history about NKA, which is New Knowledge Adventures, which we have been doing for several years, but this year it's really been something different. This whole program has been about 15 years old, and it's all volunteers. It was created in Pocatello in a partnership with Idaho State University. There's so many volunteers that are helping us. And this year, definitely with our technology, we are all in a new learning experience. This program has its own volunteer governance. There's many volunteer instructors. This is all done out of the goodness of everyone's heart to educate all of our participants. And in 2014, Idaho University Meridian and Treasure Valley YMCA formed a partnership to expand New Knowledge Adventures into Treasure Valley. And today, New Knowledge Adventure continues to offer many dynamic classes and a lot of new learning experiences. So, of course, fall of 2020, we decided we wanted to continue to do this. And due to the COVID-19 pandemic, we really could only offer them online. So we're hoping you are participating and enjoying these classes. We're going to be continuing them. We will be ending our fall session this next week, and then we are going to continue these into the spring. So hopefully you'll tell other people about these classes, and we'll continue this going. This is all driven by volunteers. I've asked Heather to do this participation for us today so we could all learn a little bit of new knowledge. I'm hoping you'll give her a warm welcome and the time that she's taking out of her day today to give this whole presentation to us. She's in her office at Delta Dental on Park Center in Boise and put this presentation together for you. A little brief description, I want to say, on her experience is that she's now the director of oral health and the professional relationships at Delta Dental in Idaho. This is her passion, and she'll be talking passionately, as you'll see, in regards to oral health and taking care of your mouth, your teeth. It's connected to your body, so that's important, and the well-being of the whole person. Heather holds a master's degree in public health, and she's a registered dental hygienist, and she has more than 18 years of experience in clinical dental hygiene. She's a former manager of oral health and wellness solutions in the Northeast Delta Dental. Now she lives in Boise, so of course she's following her passion, taking it to the Northwest. At this point, I'll let her maybe tell you something about her background also, and she's a project manager for health. She was at one time the project manager of Healthy New Hampshire Foundation in New Hampshire. So Heather, go ahead and take it away and tell us what you'd like to say about yourself, and then head out down that road of your Tooth Truth presentation.
Thanks, Marie. You said enough about me. I get like sweaty when people start talking about me. So, and it's just so embarrassing. Anyway, because I'm just following my heart. And like you said, I've been a dental hygienist for a long time. And I left private practice, and private practice basically is, working in a dental office for a dentist and seeing patients hour after hour after hour. I decided that that was a little too boring for me. I did that for a long, long time. I moved into teaching education. I taught at Forsyth School of Dental Hygiene, which is in Boston, and also my alma mater, the University of New England, which is in Maine. And teaching and sharing a really tough and sometimes really boring topic is something that I wanted to kind of make exciting. So hopefully you guys will learn something today. at least one little thing. I do want to say that overall health includes your mouth. Okay, so the mouth is connected to the body. I'll probably say this 100 times, so you will leave saying the mouth is connected to the body. And I don't think that enough people or professionals or the industry for insurance, all kinds of things, they don't seem to connect the two. So I'm going to connect that for you today, and we're going to have some fun, I hope. I do want to say that I always start my presentations basically at the most basic level, and that is with children, and that's about cavities. But don't fret, because what I've learned is when I do speak that you are not a child, obviously, but you have had children, and you might have children that have had children, and so on and so forth. So I think it's really good to start with the most basic things. So basically, health starts in your head, like literally. All right. And I mean that. All right. So let's see if I can move these here.
So Heather, I'm just going to tell everyone if they have any questions that you can put them into the chat window, and I will pay attention to the chat. If there's something that you want an answer on right away, I'll interrupt Heather. Otherwise, we'll hold our questions to the end, and we're all muted at this point so that Heather has this floor.
Yeah, I will say I do presentations all year long, all the time. They're normally in person. Actually, Marie and I think about this time last year, started talking about me doing something, and then it was going to be in April, and then boom. So now we're all, here. So normally in my presentations, it's a conversation. I want to just, have the audience raise their hand and things like that. So do whatever you feel comfortable doing. Another little caveat I want to say is I do have some photos that are a little descriptive, but I think it's really important that you understand. So when I explain something to you, you understand what I'm talking about. What I learned as a dental hygienist, when I had somebody in my chair and they're laying on their back, and I say, oh, there's a dark spot here, or I see this, or I see that, there's no reference for them. They are just like, okay, what do you mean by that? So you'll kind of understand, maybe some photos will help with that. So they are a little graphic, but I like blood and guts, so you're gonna have to like them too this morning. So let's get started. All right, so we're gonna start with dental decay. Like I said, it's the most basic thing that we talk about, we know about. Children get dental decay. As you see these photos, they are really, really, really sad, but it does happen. Kids get cavities, okay? Cavities is the single most common chronic childhood disease. So it's the most common chronic means long-term, long overlasting childhood disease. It is 5 times more common than childhood asthma. So we know we treat children when they have asthma, so we need to help children when they are suffering with cavities. One thing I do want to say is that there are 55 million school hours lost every single year for children that have decay and cavities. They're in pain, they can't learn, their nutrition is altered, they really, really struggle. And what I have learned about children is that they don't really know how to communicate the pain. They don't know how to talk about it. They don't know really how to say stuff. So what I've learned is they'll say like, it burns, different kind of descriptors. So kind of pay attention to that. If you see a child that has decay like this, that I'm showing this photo, this is called baby bottle rot. This is probably a child that was put down with a bottle that had milk in it or juice or something to that effect. And you'll know that that's cavity. So when you don't see that, but you talk about children, then they talk about something burns or something bothers them, take a closer look, because it's not always this obvious. Dental decay, whether you're a child or whether you are an adult, is a communicable disease. You can pass cavities from one person to another. And you as a parent, a grandparent, an aunt, an uncle, if you're feeding baby and you want to taste the food on a spoon to make sure it's not too hot before you're feeding them, you're putting your bacteria on there. If you don't have good oral health, you can pass that along to the child. So children aren't born with major bacteria in their mouth. It's obtained, okay? So communicable disease, it is, you can pass it along. So a case like this it has to actually be taken care of in an operating room. A child is put to sleep, and this is all restored. I don't know if you've ever seen children with silver crowns on all their teeth or several of them. That's what this is about, and that's how it's restored. It takes place in an operating room, not the dental office, like I said, and normally a case like this costs about $20,000 or $30,000 to repair, and that's a big chunk of money, especially when we're talking about maybe some Medicaid patients, things like that, that we are all kind of contributing to. So I want you to understand that. And another thing that you really need to know, the most important fact, is that cavities are basically 100% preventable. There's no reason for an adult to get cavities. There's no reason for a child to get cavities. And we will talk about these things as we move forward. So here we go. So just like tricks is not just for kids, dental decay is not just for kids too. It's a childhood disease. If you've had cavities when you are younger, you're probably more prone to getting them as an adult. And we'll talk a little bit about that as we move forward. So yay, medical miracles and medical advances and things like that in our medical system are helping keep us alive a lot longer. So, people, years ago didn't live past 40. So there's a whole lot of things going on with that. So we're staying alive a lot longer. That means we need to keep our teeth longer. And for those people that do have dentures, do not be fooled. We will talk about that in a minute. And it's really important that you see your dentist. But anyway, so adults are keeping their teeth longer. What happens with the adult teeth is that you can actually get tooth decay or root decay on the roots of your teeth. Can you guys see my pointer? No. I have a little arrow. I'm sorry.
Yes, we can see it.
Okay, perfect. Thank you, Marie. So if you notice down here, this is called recession. The gum, the tissue, has receded away from the tooth. This is the crown of the tooth. This is the root. This root is called dentin, and it's really soft. It is impacted by decay much easier than the actual crown or the enamel of the tooth. So as we age, we sometimes have some recession like this. So when your dentist says you have a little bit of recession, this is what it looks like. It means it's pulling away from the tooth, the gum is, okay? And this is an extensive case. So when your dentist says you have a little recession, don't freak out about it, but make sure that you understand what that means. So recession is pulling away from the tooth. The tooth root, which is here, is dentin, and it is more prone to decay than the enamel. So due to several different reasons is why we have recession. And one is reduced saliva or dry mouth. That can be caused by lots of different things, but mainly as we age, it's prescription medications. So you have dry mouth, you can be prone to recession. If you have issues with grinding your teeth or gritting your teeth at night when you sleep, this is something that can happen as well. You can have receding gums due to poor diet. You can have receding gums due to smoking and also poor oral hygiene. So we're going to get into that in a second. And then if you notice, adults lose 164 million hours of work each year due to oral health problems. So, and this is important to employers if you're still an employer and you have people working for you. So this is really important. Now, if you see down here, I wanted to show you there is a small cavity here. It's very small, but in B, you can see the x-ray, this dark spot, that's decay. That's why you have x-rays done, so they can see it. Number C, they are restoring it. So what they do is they take out all the bad and they will refill it with some different types of materials. You can do amalgam, which is the silver type fillings that we talk about or you hear about. or they can do a resin, which is nice and white and that kind of thing. So I just wanted you to guys to see what that looks like. So when someone says you have a cavity, it could be just as simple as something like up here in A. Okay. So something that's really important that I like to talk about, well, I don't like to talk about it because I don't want anyone to go through this, but it happens. And so there's something called gum disease, okay? Gum disease is what I call like the overarching umbrella. So under gum disease, so gum disease is the umbrella. Under gum disease is something called gingivitis. And there's also something called periodontitis, which we'll get to. But gingivitis, itis means inflammation. Gingiva, that's the dental term for gums. Okay, so you have inflammation of your gums. And you can see the picture on the left, there's gingivitis, and the gums are puffy, they're red. If you just look at them, they'll bleed. They're like angry, right? And that picture right there is gingivitis is usually caused by plaque, which is bacteria that's alive. It sits on our teeth, especially right here at the gum line. So if you're not brushing your teeth correctly, you're just brushing down here, you're not removing plaque that sits at the gum line. So this right here is a case of serious gingivitis. And when I also talk about gingiva or the gums, those are the supporting structures of your mouth. So you have gingiva, you have gums, you have, which is also tissue. You might hear that word tissue. You have bone, you have your jawbone, right? Upper and lower jawbones. That's what holds your teeth in. All of these things are supporting structures of your teeth, and you have to keep them healthy, or you can have issues with your teeth later on. So keep your supporting structures of your mouth healthy, and we'll go over that in a second. So anyway, the slide on the right is a healthy mouth that you literally can go from gingivitis to healthy gums within about 72 hours for the most part. Some people a little bit longer, but a good solid brushing and getting the floss up here and these under this gum line, you can go back to healthy and nice and tight and pink gums, not red and angry and they don't look like raw hamburger. So just know that you can go from gingivitis back to health. You can also go from gingivitis to more unhealthiness. And so we don't want to do that. So we'll talk about that. So gum disease, like I said, it can lead to tooth loss. If left undisturbed, the plaque, it can cause breakdown of the gums, the teeth, and the bone. So plaque is bacteria, it's alive. It loves to hide in between our teeth. It's dark. There's no oxygen in there. They're like, yeah, this is great. The bacteria love to live in dark places. And so that's why brushing and flossing is so important. But what I want to discuss here really quickly, and there's a couple different photos. Let me get them up here. All right. So you can have gingivitis and you can become healthy again. Like I said, you can also have gingivitis. And over time, if you stay in gingivitis for a while, gum disease, it leads to tooth loss and it leads to other issues. And so gingivitis can progress into something called early periodontitis, which is right here, the first picture. Now, when you're in the dental office, this is something that you really need to remember. They should be doing an oral health screening and a periodontal screening every time you go in. The periodontitis or the periodontium of our mouth is the supporting structures. So you're going to have disease of the periodontium, which is bone tissue and so on and so forth. So when you're in the dental office, usually I'm standing up in front of people and I can show them all these little tricks and stuff. I show them this instrument, but we use something called a probe. And a probe is this instrument right here. It's like a little measuring stick. It's really small and it can slide between your gum and your tooth. That is how we measure the health of your tissue, the health of your mouth, okay? So as you see, early periodontitis, this little probe, it goes in between the tooth. It goes down about 4 to 5 millimeters. You notice that there's some inflammation, the tissue's red and puffy. time, that inflammation causes bone loss. So you see how it progresses. You go into moderate periodontitis, and then you go into advanced. When you get to moderate and advanced, if you think about it and you're losing bone that hold your teeth in, what can happen? Your teeth can become loose. They can fall out over time. So don't worry, this doesn't happen like overnight. This is a process. So, but I just need you to kind of know about it. And I also want to notice that, so the plaque that is sitting right here that was normally at the gum line is now going down onto the root. It's going down further and further into the root. So the bacteria actually goes down further. That's why sometimes you have to have what's called a deep cleaning. And a lot of times we do deep cleanings and we can remove that, and then the tissue can become healthy again. Once you've got down to moderate or advanced, you can get better. You'll never, it'll never be back to pure health again because you've lost bone and tissue, but you can maintain it and be healthy. All right. So I want to talk about tobacco and gum disease. Smokers have 6 times more gum disease and bone loss than non-smokers. You fill your mouth with smoke. You fill your lungs with smoke. Oxygen is what goes through all of our veins and arteries. Well, not both of them, one of them, arteries, I think. And then anyway, so arteries. So if you're taking in tobacco and you're taking in chemicals that's in your bloodstream, that goes to your mouth, okay? And so if you don't have oxygen in the blood, you have some other type of pollutant, your mouth is not getting the healthy blood that it needs. So you can have more bone loss than non-smokers. The heat and chemicals from smoking, they cause tissue damage, they cause oral cancer. There's things that we'll talk about in just a second. Chewing tobacco contributes to oral, stomach, and larynx cancers. So one of the things that I stress greatly is, number 1, have a periodontal screening every time you go into the dentist. Number 2, oral cancer screening. These are part of your exams. They're not extra. You shouldn't be paying extra for them. They are part of what the dentist should be doing. And Shenna's daughter is a dentist and she knows this stuff. So that's good. And we'll chat about that. Anyway, chewing tobacco. All right, what do we know about e-cigarettes and vaping? Well, there's not a whole lot of information because it's really, really new. A lot of people start vaping or they do e-cigarettes to stop smoking. But the additive that you put in an e-cig or into a vaping pipe, I mean, it's red, it tastes like cherry, it's heated up. Really? That I can't imagine that is any better than tobacco going through our mouths. And actually, studies are starting to show it is worse. The problem with e-cigs and vaping is we replace smoking with that, but also children now can buy this stuff right at the corner store. It says there's no nicotine. Probably there isn't, but there are colors and additives and flavors. And when you heat that stuff up, I mean, it's kind of a no-brainer, right? So if you are an e-cig person or a vapor, think about it, read about it, learn a little bit more so that you understand it. All right, again, oral cancer. I am a huge advocate of an oral cancer screening. I should actually come up with a video that shows you exactly what it should look like and feel like. So anyway, roughly 3% of all cancers are diagnosed annually in the US. So oral cancer is 3% of all the cancers. Approximately 52,000 people will be diagnosed with oral cancer this year. About 10,000 will die from the disease. And oral cancer in adults is associated with smoking and excessive alcohol use. So if you smoke, that's one thing. If you smoke and drink, they exacerbate each other. They make it worse. So I always just say, I don't want you to quit everything. Just be careful about excessive use, okay? Also, there's an increase in oral cancers in younger folks, and that's related to a virus called the human papillomavirus. I think that it's really important that we do talk about it. I don't think that dentists talk about it as much as they should because it's a sexually, it's taboo. We don't talk about this stuff, and we especially don't want to talk about it because it involves children, and children are a lot more, in my world, they're a lot more exploratory. They do things like, wow, I didn't even do that. I didn't even know that you could do that when you were 12. So the thing about the human papillomavirus is there is a vaccine, and children should be vaccinated starting at about the age 12. These cancers don't show up until someone's in their 30s, and it usually shows up in the back of their throat. So it's really important for an oral cancer screening to be done. What I want to tell you about an oral cancer screening is that the dentist or the dental hygienist, I used to do them all the time. It looks like this. Like I would take a 2x4 or a 2x2, a 2x4, that's a piece of wood. No, I take a little piece of gauze and I pull out the tongue. I flip it side to side. I look at it. I use my fingers and I touch the sides of it. I actually take 1 or 2 fingers and push on the floor of the mouth with one hand, and on the inside, I actually feel around. I make sure I put my thumbs in the cheeks. I rub to make sure I don't feel any lumps or bumps. I actually look with a light. I want to make sure that you all have this done. It's very, very important. A lot of times I used to feel the back of someone's neck, the front of their neck, because we have nodes and we have things that can be swollen, and it can kind of show us that there's something going on beforehand. So let me just tell you something. If you go to your dentist and you ask for an oral cancer screening, you're going to sound like super, super smart. And they're going to be like, wow, this person is on my tail. So make sure that you ask for an oral cancer screening every single time you go into the dentist. Also know, I think it's 40% or 60%. I'm not positive which, because I can't remember exactly, but 40 or 60% of people, they get oral cancer. They never smoked in their life. So I want to say it's 40%. So 40% of people that get oral cancer, they never smoke. So most people are like, oh, I don't smoke. I don't need this. Yeah, you do. And also, if you have dentures, okay, you still need an oral cancer screening. That's the bottom line. You still have bone, you have tissue, you have a mouth still. And sometimes if the denture doesn't fit right or it doesn't feel comfortable, it can be rubbing tissue. It can cause other issues. So I hear people all the time, oh, I have dentures. I don't need to go to the dentist. I'm like, yeah, you absolutely do. At least once a year. Okay. So let's do that. All right. So what I talk about mostly is prevention. Remember I said cavities are 100% preventable? They are. And it basically is, how do we prevent cavities? And then how do we prevent cavities as adults that get onto our root surfaces, and so on and so forth. And it's like a progressive type of thing. So let's talk about prevention measures. So prevention, I talk about fluoride. It's very, very important. Fluoride can be in the water or it can be topical. And I'm going to explain what this means. So when you drink something, it goes systemically into your system, right? So you're drinking water, it maybe has fluoride in it. It's going systemically. It's impacting your jawbone. It's impacting your teeth. It's systemic. It's going in. You do have to be careful with how much fluoride is in water. But if you live in a municipality or a town that has fluoride in the water, it's very, very regulated. What is most important is if you have well water can have really high amounts of fluoride in it. Fluoride is a naturally occurring substance in our earth. Okay, it's not, we don't create it. It's a naturally occurring substance. So if you have a well water and there you go, you want to make sure that you have your well water tested, that it's not too high. Okay, because that can cause some problems. But you can do a little water sample. You can send it off to the water people here in Boise or wherever you live in Idaho, and they can test it for you. And if you don't have enough fluoride, you can do a supplement, but if you have too much, then we want to get you some filtration systems to take that fluoride out of your water. So there's systemic, which I just said, which is when you ingest it. And then there's topical, and topical fluoride goes on top, right? It goes on top. You go to the dentist. Remember when your kid used to bite into those like styrofoam trays and your mouth watered and you had to sit there for 5 minutes with this stuff in your mouth? That's topical fluoride. All right. Nowadays, we don't have to do that crazy stuff. We have stuff we just paint on real quickly. It's called fluoride varnish, and it's really important. Fluoride is not just for children, okay? It can be for adults as well. So if your dentist is saying, you know what, you need a little extra fluoride, you know, you go to your dentist for a reason. They're the professional. They know what they're talking about. And so you probably should pay attention to what they are mentioning or suggesting. All right. Another thing about prevention is sealants, okay? Sealants is a smooth plastic kind of coating. It doesn't have any BPA and all that crazy stuff. I just say that because it's easy to explain. It is applied to the pits and fissures of our molars and premolars. Now, if you notice in the first picture, there's nooks and crannies. Bacteria can get in those nooks and crannies. It sits there, it's dark. Again, they're having a party. They're creating decay in your teeth. You don't want that. So a sealant, if you notice over on the right side, is placed. It takes just minutes. It doesn't hurt. And it actually fills in the nooks and crannies and all the grooves. And so bacteria just kind of slides right off. Okay. So a sealant placed on one tooth reduces the amount of decay on all the surfaces of that tooth, not just that chewing part, but the sides, the back, the front, all that stuff. And there's terms for that: mesial, distal, proximal, but I won't go into those. So sealants are really important. Adults can have sealants too. So make sure that you ask about that and that it's really important. All right. So Marie did mention that I used to be a program manager for the New Hampshire Healthy Foundation, and I started a program of taking hygienists and putting them in WIC centers. WIC centers, WIC stands for Women, Infants, and Children, and families go there to qualify for food benefits, and they go every 3 months. So I was like, you know what? These children aren't seeing a dentist because they're little. Most children are not seen until they're about 5. But the truth is they really should be seen by the time they're 1 or when their first tooth has erupted. And so we talked about this. This is a little boy that came in with his mom, obviously. And, you know, he had like 2 teeth down on the bottom, but I'm getting him comfortable. I'm noticing, you know, what's going on around me. I noticed that mom walked in with a huge bottle of Mountain Dew under her arm. And I'm thinking, okay, nutritional counseling. I'm not obviously talking to baby about this, but I can kind of say, hey, mom, you know, do you understand bacteria? Do you understand sugar? Do you understand the relationship? Which I'm going to teach you in just a second because a lot of people don't understand it. And so I can talk to mom and kind of educate her. And at WIC, they would come in every 3 months, like I said, for the food benefits. And so I could build a relationship with this family, and I could talk to this mom and this child for the next until they're 5 years old, because they get WIC benefits till they're 5. So anyway, but this can happen in lots of different places. And so it's not just a WIC kind of thing. So I also, topical fluoride, which we talked about, we can apply to children. But here is where nutritional counseling really comes into play with mom. That's really, really important. So dental care by age 1, not 5, not 3, 1. Most dentists will say 3 or 5, but they really should be seen by the time they're 1. And I know we're talking a little bit about kids, but we're going to move on in just a sec. So don't, you know, worry about that. So dental care tips for healthier teeth: brush your teeth twice a day. Remember that gingivitis picture? You want to put the bristles of your toothbrush angled right into that gum line, and you want to do little baby circles to remove the plaque that's at the gum line. You want to brush your teeth twice a day for at least 2 minutes each time. 30 seconds, that doesn't count, people. All right, so 2 minutes. Get an electric toothbrush that has a timer on it, and that'll help you. You want to floss your teeth. Remember the gingivitis picture? You can slide that floss right on up there. Now, the person in that first picture, yes, you put the floss in there, it's going to bleed. That's the body's way of protecting itself. It's okay. If your mouth bleeds, it's okay for a certain time being. But as you saw on the right hand side, the picture that the gums were nice and tight and pink, there's no bleeding going on there. So You want to floss your teeth to remove the plaque that hides in those spaces that a toothbrush can't reach. We want to limit sugary foods to avoid tooth decay. We're going to get into that in a second. You know, maybe quit smoking and drinking. When I talk about yellowing teeth, I don't really care about that. I think that health is more important than the color of your teeth, but some people are really, really into white teeth. And so smoking and drinking, that can eliminate that. And then regular dental visits for preventive care. Preventive care can be done in the dental office, which is an exam. It's an oral cancer screening. It's just kind of checking you out and seeing how you're doing. So what can you control? This is what's really, really important. So our mouths are acidic or they're alkalinic. So when you have an acidic mouth, and we'll talk about it, actually, let me think about the decay of teeth. Okay, so your mouth is, what you eat and drink causes your mouth to be acidic or alkalinic, okay? So what you eat and drink, soda, number one, is a ton of sugar, right? Even, okay, you diet soda drinkers, hold on there. You're not perfect either. So let me just go on here. So soda has acid. Soda has acid in it. It's acidic, okay? And regular soda contains both, and it can cause cavities. Diet soda and flavored waters are sugar-free, but they still contain acid. And let's think about this. When you eat something that's like fat-free or low-fat, they're just taking out fat, but they're putting something else in there, okay? So I'm all about eating full-fat foods and all that kind of stuff. And when I drink a soda, I drink it and I drink it down. It's gone. I don't sip on it all day long, and we'll talk about that in a second. So the lower the pH, the worse it is for your teeth. And just remember this, 7 pH is neutral for best teeth. And here's why, because I have a really cool chart for you. So a lot of people love this. So let's just say neutral again is 7, right? Tooth enamel, if your mouth, it stays at 7 because you're drinking lots of water and milk's probably okay for a certain time being, then it's your enamel starts to break down at a pH of less than 5.5. So let's look all the way at the top. So battery acid, car battery acid is a pH of 2.0. Stomach acid, 2.0. Coke and Pepsi, 2.3. What? Why don't you just drink a big cup of battery acid? Because really, that's super, super close. And I'm sure the Coke and Pepsi taste better. But anyway, so the main thing that I want you to take away from this is this. So when you eat something, you chew it up, your saliva is going crazy, you swallow, and it takes 20 minutes for your mouth to go back to neutral. 20 minutes. So if you have a soda or you have orange juice or whatever you have that's high in sugar and very acidic, if you're drinking a sip every 10 minutes, your mouth for the whole day, because some people really do, they get those big gulps or they get those big coffees that are full of sugar, they sip all day long. Your mouth is never able to go back to neutral, to healthy, to the way it's supposed to be. So I'm not against sodas or I'm not against, wine or I'm not against any of that stuff, but have it, be done with it and move on. Okay. Don't sip on something all day long. And you diet soda, folks, it's the same thing. There's acid in there that causes cavities. Okay. So that's the main thing. What also happens when you get a cavity, when you have plaque in your mouth, and because you haven't removed it like you're supposed to with your toothbrush and floss, and you eat sugar, the bacteria eats the sugar too, right? And then it produces, because it's alive, they're bugs, it produces a byproduct, which is acid. So plaque and sugar, bad. And then drinking things that are acidic as well, you're just like, just pull your teeth out. No, I'm just kidding. Don't do that. But I'm just saying it's really about education. And I think that this slide right here is one of the most important things. I get questions on this, like, we can spend 20 minutes on this kind of stuff. So anyway, so just remember, tooth enamel breaks down at 5.5. So anything below 5.5 can cause cavities. Like I said, drink your spray, drink your Dr. Pepper, drink your beer, whatever. Drink it with your meal. Don't sip on it all day. Get her done and move on, all right? If you do slip something in your mouth, you know, whatever, between snack, you have a snack or whatever, just rinse your mouth out with water, make it go back to neutral again. That's really, really important so that you can stop decay in its tracks, which is pretty cool. So, and don't try any of this at home like the car battery acid, because I don't want to get in any trouble. So that's important. And again, most people say like, I'm never going to drink Coke again. No, that's not what I mean. All right. Just moderation, and remember that, the mouth, it takes 20 minutes for the mouth to become neutral again. So just remember that. I always ask this question when I'm in public or standing in front of 100 people, and I'll say, is it better to eat a pack of Lifesavers at once or suck candy throughout the day? Now that I explained the whole thing to you, you're going to know the answer. But is it better to eat it all at once or pop one in your mouth every 10 minutes? Or a mint or anything that has sugar in it, okay? I don't want anyone to eat a whole pack of Lifesavers at once. I think that's really weird. But if you're going to eat candy or whatever, make sure that you do it and then move on. All right. So what can you do? You can visit your dentist at least once a year, even if you have dentures, okay? Dental care by age 1. I'm going to be 53, so I don't really, you know, but my nieces and nephews, I make sure that they're taken care of and that they understand this stuff. So follow instructions for care. Like I said, brush, floss, and fluoride. Brush twice a day for at least 2 minutes. Floss once a day at least. And people will ask me this too. Hey, Heather, should you brush first and then floss, or should you floss and then brush? Well, in my world, I feel like I'm going to floss my teeth first, pull out all the yucky stuff, then I'm going to brush it off. So that's just my take. There's no the studies or anything, you know, there might be, but I'm just saying, pull out all the yucky stuff and move on. And then brush. All right. This is something that I just want to talk about prevention really quickly. It's numbers, and this is based on national averages, and maybe not interesting to you, but I think that it should be, and it really makes sense. So we talk about prevention. Prevention is cheaper than actual treatment. And Marie knows this. Marie worked for Delta Dental of Idaho for a long time, and she understands prevention and the cost associated to this. So let's look at fluoride. On average, national average, fluoride is $31.70 for a child. An exam is $44, a cleaning is $61, and a sealant is $44. I've seen them way cheaper than this, so I'm just saying national average today. I don't think Idaho is this expensive. But so we look at all the things I talked about that are prevention, right? Now, we talked about prevention, then there's restorative. Restorative means you didn't have the prevention you needed, so now we have to restore your mouth and fix it. So an amalgam filling, which is the silver one I talked about, is $146. So let's go back, and a sealant, which was $44, could have been placed on that tooth, probably not gotten any decay, but now that you have, it's $146, right? So a white filling is $197. Again, a sealant was $44. A root canal on a molar. So here's what happens with the tooth. You get decay, you get it fixed, you get it restored. They drill out the decay, they fill it in with a material, whether it's amalgam or resin. Over time, you're gonna you can get a cavity again on a tooth that has a filling because it has like a little edge, so bacteria can get in there, and it doesn't happen right away. I mean, I've had fillings for 20 years now, and they're okay, but I take care of my mouth. But fillings can break down. They're not your natural tooth. They can break down. You can get decay again. So then they take out the old filling, they make a bigger hole, and they fill it bigger. And over time, basically you're removing all this tooth structure. Then you need a root canal, okay? And a root canal is they take out the nerve of the root, and so you don't have any pain, and basically you're not getting a blood supply to that tooth. And once you have a root canal, you need a crown. because the crown covers up the tooth. And so the root canal is $900, a crown's $1,000, and a sealant's $44. I mean, I don't know. So let's just think about that. I personally want to save this money, and when we can go on vacation, I'm going to Italy. And Marie knows, because I had a trip booked in April and I had to cancel. So anyway, the dream of my life ended in April due to COVID. All right. So overall health effects your physical health. All right. Poor oral health affects the body in many, many negative ways. It's not just your teeth. You eat, you swallow food, you breathe, you speak. Your mouth is like the main, it's who you are, really. So gum disease, tooth decay, dental infections, pain, and even death can occur if you do not take care of your mouth. There are many, many cases where people that get a cavity, they don't get it fixed. It gets worse. They're in pain. Let's look at it this way. Here's your mouth. Here's your brain. Like, they're like really close, right? Like, they're really close. So if you get a cavity that gets infected, you're going to get bacteria and pus and you're going to get an infection. And this infection can spread and spread and spread. And look how close it is to your brain. People literally can die from a toothache. It's very, very serious. It needs to be taken care of right away. And it can, it doesn't happen all the time, but it does actually happen. Tooth loss can lead to poor nutrition as we age, difficulty speaking, poor self-image. Very, very big deal. It looks like there's all women on here. So I have seen women that have broken down front teeth. They talk to me like this. They cover their mouth up with their hand. Their self-esteem is just in the dumps. They can't get jobs. People are judging them because their mouth and all kinds of things like this. And so poor self-image is really important. Poor nutrition, bigger deal. If you can't chew spinach and an apple and a really crunchy carrot, which I actually call nature's toothbrush, you're going to have some problems. Uncontrolled diabetes. So gum disease is an infection, and diabetics have more difficult time fighting off infection. So if you're a diabetic and you get a cavity and then you get infection, it is really, really hard for you to fight off that infection because you're already, immunocompromised to begin with. Gum disease is what I talked about. Gum disease and the periodontitis part is a person, and this is not just a diabetic, this is anybody. If you are not healthy here, your mouth isn't healthy either, and vice versa, okay? I have seen many, many people that have diabetes. They come in, they sit in my chair. I ask them what their A1C level is. I ask them all these questions about their medical history. Dentists ask for medical history for a reason. Dentists are trained with medical, and medical and dental are connected. So if I'm asking you about your diabetes, there's a reason. And I used to have people go, why are you asking me that? I'm just like, you're here, trust me, all right? Let me do my job. So I see somebody come in, they have diabetes, I know this about them. They're doing everything they're supposed to. They open their mouth is red and puffy, just like one of those pictures we saw earlier. And I'm like, wow, what's going on here? So if you have cavities and infection and periodontal disease, it impacts your whole body. You will never get your blood sugar under control perfectly if you have dental disease. It doesn't happen. So we want to fix that to make sure that overall diabetes we're taking care of, because that's a pretty serious disease. So it contributes to uncontrolled diabetes. So you might think you have it in control, but having a healthy mouth is important for that. Also, 120 diseases can be, or signs of diseases can be recognized in the mouth. Okay, so that's really important. Oral health affects your overall health. It increases your risk for heart disease. If you have plaque in your mouth and you're not taking care of yourself, it increases your stroke possibility. It impacts rheumatoid arthritis. Alzheimer's disease, problem pregnancies, women that have periodontal disease or really poor oral health, they can actually go into preterm labor and babies are not, they're not ready to come out yet. So these are just a few things that impact. Now, they don't cause these things, but there is a correlation. So just be aware and make sure that you keep your mouth as clean as possible and hopefully help eliminate some of these things. Discuss all your medical and dental health issues with both your physician and your dental professional. It's really important. Again, oral cancer screening, make sure you get it done. Because how many times has your medical doctor said, open up? Yeah, they say but that's all they're looking at, the back of your throat. They're not looking at anything else. So we want to make sure we're as healthy as we possibly can be. This one, it's important. I think it's important for people to understand. If you have diabetes and you get the care that you need dentally, there's a cost savings of about $3,000, and hospital admissions are reduced by 39%. So people that have diabetes that have healthy mouths, they go into the hospital less, and that saves them about $3,000 on the hospital side, but also it saves about $1,500 for your drug costs and things like that when you're not in the hospital. So we want to just make sure that a healthy mouth actually does save money. And that's important because I like to save money and I don't want to have to pay the hospital some crazy cash. All right. So I believe in this power of your smile. And I think it's time that we start to acknowledge the importance of oral health. I don't think it's talked about enough. I don't think that people really make that connection. And I don't just mean normal people. I mean like doctors. It's really important that we are all connected. And so another thing I want to suggest really quickly is when I was in dental hygiene school, one of the first things we learned was how to take someone's blood pressure. A blood pressure should be taken at your dental office. It should be taken every single time. So ask for your blood pressure to be taken, ask for an oral cancer screening and a periodontal screening. Just say, probe my mouth, make sure you're doing it. And the way it sounds is when they're probing your mouth, they're going 2, 2, 4, 4, 4, 3. You can kind of hear the hygienist doing that. And then someone's putting it into the computer. They're documenting the health of your mouth. A 1 to 3 millimeter pocket is healthy and pretty normal. Anything above 3, 4, 5, 6, you're getting into some hairy issues there. You want to make sure that you keep those numbers as low as possible. And I've seen people that have 5s go back to 3. So it's really important that you do that. So make sure you have, I go to a dentist here in Boise. He takes my blood pressure and I had been going to a couple different places. And when I showed up at this guy's office and he took my blood pressure, I'm like, this is my place because he is doing the right thing. If your blood pressure is too high, you should not be receiving dental treatment. That can be disastrous. So make sure that they take your blood pressure and, be proactive and maybe get them to do some stuff. They don't do it a lot because it takes a little bit of time, but it's super, super important. All right. So any questions? If there's not, that's okay.
Okay. Anybody have anything they want to ask out loud? If not, you could put it in the chat. There's been a lot of education in this presentation. A lot of it is a strong passion for me because of always believing that you got to take care of your mouth, healthy body. How can you do that if your mouth is in bad shape? Mm-hmm. Everything goes in your mouth.
Exactly. I mean, I'm sitting here talking to you and we express ourselves, it's our respiratory. It's super, super, super important. And so I thank you for that. I know I did put out a lot of information, but if you have any questions later or whatever, let me know.
Here's a question that is coming in. This is someone that's on the call that says, I have a metal taste in my mouth. Started after I had a crown. Have been back to the dentist several times, taken x-rays and can't find anything. Do you have any thoughts on what could be causing this?
I get why you might think it's associated to the crown because it happened after that. I would sometimes if you're deficient in like magnesium or different kind of vitamins, that will help. I know I get it. It lines up with the crown. So I think I understand what you're talking about, but sometimes a metal taste can be an infection, but you've already had that checked out. I would really pay attention to maybe some of your, if you're taking the appropriate vitamins or such. That's what I would pay a little bit of attention to. I have had people that have a metal taste in their mouth and they're low on magnesium. So I'm not a doctor, but that's my experience and I'm sticking to it.
Exactly.
I wish I could like see you and like, see your x-rays and stuff like that, but I'm not a dentist either, but you go to your dentist, you trust them, and the metal taste really can be caused by other things. It can be caused by medications. It can be caused by lack of, proper nutrition, things like that.
Correct. So I just feel like there was a lot that you talked about is all preventable.
Yes.
That's exactly what your presentation should hopefully have educated anyone that was listening. And these are posted, just so everyone knows, this presentation has been recorded and it will be posted on our YouTube site. If you want to go back and refresh or send any family members or friends to this, because much of what you talk about, Heather, is being active when you go to the dentist, also to have everything checked on a regular basis. Many people say they haven't gone to the dentist because something doesn't hurt.
Right.
Why would you wait until something hurts if you can go and prevent these things from happening in the future? So in watching all that you talk about, starting with what can happen right off the bat when you're looking at these pictures of someone's mouth, the most interesting part is how you can correct it. If you start taking care of your mouth, no matter what age you are, you can make your mouth, let's say, healthier.
Yep, you can, and you probably know someone that, you can help as well. So that's why I always start with children. I know, but we were all children once and it progresses, but Marie nailed it. Like prevention is key. Make sure you get the appointments that you need and go at least once a year. Okay. And let me just say one more thing. If a dentist is advising, that you do something a little bit more, I'm not sure, an insurance plan is usually picked by an employer. Okay. And they pick it based on costs and a few other different things. So just because your employer or whatever entity supplies you with your dental benefits doesn't mean that it's not important what your dentist says. So they might suggest something that isn't covered. You have to weigh the pros and cons for that, but just make sure that they're the professional, they want to help you. And sometimes it might not be covered, but that doesn't mean that it's not important. That's really my key message about that, because the employer kind of says, I want to do this, I want to pay this much. And so, I can say, hey, employer, you need to do all of this stuff. And they're like, okay, they want to keep you as healthy as they can. And so they pick what they can do to keep you healthy. And nowadays, prevention is covered almost 100% by almost all of our plans. So I don't want to talk about Delta Dental, but I'm just saying, like, just if your dentist suggests something, go research it, study it, and understand that. And they all, for the most part, are there for your, your benefit and your health. And so that's why they went into this business. So with that said, right. Thank you so much, Marie.
And I think most people have hopefully gleaned the information that you brought up too, about the fact that now that we know some medical problems are linked to the mouth, it's most important that people get their mouths looked at like you would go to your doctor on Absolutely. A regular basis. Whether you go to your doctor once a year or twice a year, it would be the same as going to the dentist and having them take a look at your mouth just to make sure there's no linking to any of the medical problems that you might have or that may be lurking
Yeah.
and you could prevent.
I think, and with that, just my one last comment is that, you know, I used to see people that were going to have chemotherapy, or they were going to have a stem cell transplant, or they're going to have something majorly invasive done. And their surgeon or doctor would call the dental office and they'd say, how clean is this person's mouth?
Yeah.
What is their bacteria load? Let's get them back to as healthy as they can be before we actually do something super invasive. And so it is connected. Bacteria in your mouth is connected to your body and your health. So make sure that the bottom line is keep plaque at bay the best that you can. And that's the main key. So thanks Marie. Thanks, Shanna.
Thanks for showing that slide.
Yes.
With the acid in the foods, and that's very interesting.
Yeah.
People.
Well, now that you have the slide, and I can send you have the slides separate too, you know, and I actually have tons of, it's called Rethink Your Drink materials that I can share and that kind of stuff. So it's really, really important. And it's not just about little kids, right? It's about, right.
No,
So
it's for all of us, but just so everyone knows that there is a survey that you can take, and please do that. We like to hear from you, and the website is in the chat window, so you can click on that and just please, it won't even take you a minute once you're in the site to answer those few questions. We would appreciate that. And we are, like I said, we're also looking for future classes for next year. If you have any thoughts or suggestions, we'd like to hear that too. And if there aren't any other questions, I want to thank Heather so much for giving us all this great information, her presentation, her time, and her passion on keeping everyone healthy through their mouth. So with that, hopefully everyone is going to get a dentist appointment if they haven't had one, and have them get their mouth checked.
Tell them that a dental hygienist sent you, and they'll be like, okay, cool. So, you know, I need all the credit I can get. And Maria, just thank you for letting me share my message, and Shanna for the IT help, because I got really kind of cranky there for a while. But thank you so much.
I think you did a great job. We appreciate your knowledge. And
Great information. That's right.
And thank you everyone for taking the time to spend with us this morning on Monday, and want to wish everyone a great week and stay healthy and safe.
Thank you
again.
Bye.
Okay, bye-bye. Thanks, Sheena.
Thank you.
I thought it was very interesting. I'll be anxious to watch it again.